Look at your hands right now, not at the wrinkles, not at the age spots you've learned to ignore. Look at the shape of your fingers. Look at the color of your nail beds. Look at whether your hands shake when they're just resting quietly in your lap, because I'm about to show you something that most doctors have never taken the time to explain to you. And after 60, what your hands look like on the outside can reveal three very serious diseases quietly destroying your body from the inside. Stay with me, because what I am about to share could literally change the direction of your health. My name is Dr. James Mercer. I am a board certified physician with 35 years of clinical practice and over 40,000 patients treated in that time. Every single day I walk these hospital corridors, I see patients who came in too late, patients whose bodies had been sending them warning signals for years, signals written right there on their hand, signals nobody ever taught them to read. That changes today. Consider this your private consultation. I want you to pull up a chair, take a breath, and really listen, because what I am about to show you is the kind of information your body deserves you to have. In my 35 years of practice, I have sat across from thousands of patients just like you, men and women in their 60s and 70s who thought they were doing fine. They were managing, they were getting through the day, but when I looked at their hands, really looked, I could see the story the rest of their body was trying to tell. The tremor that started quietly in one finger, the nail beds that had slowly changed color, the knuckles that had swollen just enough to make buttoning a shirt feel like a battle. These were not random inconveniences. These were dispatches from deep inside the body, and most doctors rush right past them. I am not going to rush past them. Not today, not with you. Let me start by telling you something that should make you stop and pay attention. After the age of 60, your hands become one of the most diagnostic surfaces on your entire body. The blood vessels, the nerves, the joints, the skin, everything converges in those 10 fingers and 2 palms. And when something goes wrong in the cardiovascular system, the nervous system, or the musculoskeletal system, your hands often find out first. The 3 diseases I'm going to walk you through today are Parkinson's disease, cardiovascular disease, and a condition most people have heard of but massively underestimate after 60, autoimmune-driven joint destruction. And I want you to understand right now that these are not rare diseases. These are not exotic conditions that happen to other people. Parkinson's disease affects approximately 1 in every 100 people over the age of 60. Cardiovascular disease is the leading killer of Americans, and autoimmune joint disease affects tens of millions of seniors right now, right this minute, many of whom have no idea the systemic damage being done beneath the surface. So let us begin at the beginning. Let us begin with what your hands actually look like right now. I want you to set your hands flat on a table in front of you. Just let them rest there, completely relaxed. Now watch them for 30 seconds, because the first thing I am looking for when I examine a patient in this setting is the presence of a resting tremor. Not shaking caused by lifting something heavy, not vibration from holding a coffee cup too long. I am talking about a tremor that appears specifically when your hands are doing absolutely nothing. Most people know that Parkinson's disease involves shaking, but here is what most doctors never tell you. The shaking is often the last thing people notice about themselves and the first thing everyone else notices about them. The Parkinson's Foundation has documented this clearly. In the earliest stages of the disease, the tremor is so subtle that the person experiencing it is usually the only one who notices it at all. A slight rhythmic movement in one finger, a barely perceptible quiver in one thumb. It typically begins on one side of the body and stays worse on that side for years before spreading. But here is the thing that should make every person over 60 stop and think. By the time that resting tremor becomes obvious enough to see across a room, the disease has often been progressing inside the brain for a decade or more. Research published in major neurology journals has established that Parkinson's disease damages the dopamine-producing neurons in an area of the brain called the substantia nigra, and those neurons are already significantly depleted before a visible tremor ever appears. Dopamine is the chemical that allows your brain to send smooth, coordinated signals to your muscles. When those neurons begin to die, The signals become choppy, irregular, and eventually visible. Now, here is what I need you to understand. The resting tremor is only one hand sign of early Parkinson's. There are two others that I see regularly in my practice that almost nobody talks about. The first is a change in handwriting. Neurologists call it micrographia, and what it means in plain English is that your handwriting has gradually become smaller and more cramped than it used to be. If you pull out an old birthday card from 10 years ago and compare your signature now to your signature then, and you notice your letters have shrunk significantly, that is a signal worth taking seriously. The second sign is something called bradykinesia, which is medical language for slowness of movement. Fine motor tasks that used to be automatic, buttoning a shirt, picking up a coin, turning a key in a lock, begin to feel effortful and sluggish. The hands simply do not respond the way they used to. And at your age, this is far too often dismissed as simply getting older. But it is not always just aging. Sometimes it is the brain losing its ability to generate fast, fluid movement signals. And sometimes it is the beginning of a neurological process that needs to be caught now rather than later. Stay with me, because what I am about to share about your heart is going to surprise you. Now let us look at your nails, and I mean really look at them, because your fingernails are one of the most underused diagnostic tools in medicine, and I have been furious about that for most of my career. Here's what I want you to check. First, look at the color of your nail beds. If you press gently on the tip of a nail and release it, the color should return to pink within about 2 seconds. That quick return of color is called capillary refill time, and it tells me how well blood is circulating to the very tips of your fingers. If that color takes longer to return, or if your nail beds look persistently pale, bluish, or purplish, your cardiovascular system may be struggling to push oxygenated blood all the way to your extremities. Now look at the shape of your nails and fingertips. Do your fingers look slightly bulbous at the tips, as though the ends have swollen gently outward and the nails curve down over them like a beak? Dermatologists and cardiologists call this clubbing, and while it can sometimes be harmless, it can also be one of the body's clearest signals that oxygen delivery is chronically impaired. The American Academy of Dermatology has identified nail clubbing as a warning sign of heart disease, heart infection, and lung conditions that reduce oxygen circulation. The mechanism is precisely what you would expect. When the heart cannot pump efficiently, or when the lungs cannot transfer oxygen properly, the body's tissues respond to chronic low oxygen by altering the way cells proliferate around the nail beds. Now look underneath your nails at the skin below. Do you see any thin, dark streaks running in the direction of the nail? Dark reddish or brownish lines that look almost like a splinter trapped beneath the nail surface. These are called splinter hemorrhages. And when they appear alongside other symptoms like fever or an irregular heartbeat, they can indicate a condition called endocarditis, which is a bacterial infection of the inner lining of the heart itself. Left untreated, endocarditis is life-threatening, and it whispers its presence through your fingernails. There is one more hand sign of cardiovascular disease that I see constantly and constantly have to explain to my patients. Look at the skin on the backs of your hands and around your knuckles. Do you see any small yellowish waxy growths, any deposits that look like slightly raised pale yellow bumps that have no business being there? These are called xanthomas, and they are deposits of cholesterol building up under your skin because there is too much of it circulating in your bloodstream. The American Heart Association is very clear on what elevated cholesterol does over time. It builds plaque inside arterial walls, narrows the vessels, reduces blood flow, and sets the stage for heart attack and stroke. When that cholesterol is so high that it begins depositing under your skin, your arteries have been under siege for a long time. Keep watching, because what I'm about to reveal about your joints is the piece most doctors never connect to the bigger picture. Now let us talk about the third disease hiding in your hands, and this one is more dangerous than most people realize because it is so frequently written off as normal aging. Look at your knuckles. Look at the joints of your fingers. Are they swollen? Are they tender when you press on them? And here is the critical question. Is the swelling and stiffness worst in the morning and then gradually improves as the day goes on? Because that specific pattern Morning stiffness that eases with movement is a hallmark of inflammatory arthritis, not wear and tear arthritis, inflammatory arthritis, the kind that is driven by your own immune system attacking the lining of your joints. Rheumatoid arthritis affects somewhere in the neighborhood of 1.3 million Americans, and its prevalence increases significantly after 60. But here is what most doctors never tell you about rheumatoid arthritis. It is not just a joint disease, it is a systemic disease. When the immune system becomes dysregulated enough to attack joint tissue, it does not politely stop at the joints. The same inflammatory process that destroys cartilage and bone in your fingers simultaneously attacks the blood vessel walls throughout your body. Multiple studies have confirmed that people with rheumatoid arthritis face a substantially elevated risk of cardiovascular disease because the chronic inflammation from the immune system circulates through the bloodstream and accelerates the buildup of arterial plaque. The disease your doctor is treating as a hand problem is actually a whole body problem. And here is the piece that connects all three diseases I have described today in a way that should make every person over 60 pay close attention. Inflammation. Neuroinflammation has been linked to accelerated Parkinson's progression. Vascular inflammation drives cardiovascular disease. Systemic inflammation is the engine of autoimmune joint destruction. These three conditions share a common thread. And your hands are the bulletin board where the body posts the news. Now, I am going to tell you exactly what to do about it starting tomorrow morning. The first step is the simplest and most powerful thing I can tell you to do. Every single morning before you get out of bed, do a 30-second hand check. Hold your hands up and look at them. Are they stiff? For how long after you wake up does that stiffness persist? Any morning stiffness that lasts longer than 30 to 45 minutes consistently is worth reporting to your physician. Mark it down. The date, the duration, which joints. Data is what gets you taken seriously in a doctor's office. The second step concerns something I call the dopamine nutrition protocol. And this is not something you will hear in a standard 15-minute doctor's appointment. Your brain's dopamine-producing neurons are profoundly sensitive to oxidative stress, which is essentially cellular damage caused by unstable molecules called free radicals. The research on this is consistent. Foods rich in antioxidants, particularly deep green vegetables like spinach, kale, and broccoli, wild blueberries, and foods containing a compound called glutathione actively reduce the oxidative burden on the neurons most vulnerable in Parkinson's disease. Specifically, I recommend that every person over 60 consumes a daily serving of cruciferous vegetables. Broccoli, Brussels sprouts, and cauliflower contain a compound called sulforaphane that research from institutions including Johns Hopkins has shown to activate the brain's own antioxidant defense system. Do this every day, not most days, every day. The third step is about your cardiovascular system, and this one requires you to take a hard look at something. If you are over 60 and you have not had a full lipid panel checked in the last 6 months, you need to make that appointment today, not next month, today. Because the cholesterol deposits I described in your skin, those xanthomas, do not appear overnight. They appear after years of unchecked lipid levels. Meanwhile, your arteries have been narrowing silently. What you can do starting now is eliminate refined seed oils from your diet. Canola oil, soybean oil, corn oil, vegetable oil. These industrial oils are loaded with omega-6 fatty acids that promote arterial inflammation. Replace them with extra virgin olive oil, which contains oleocanthal, a compound with anti-inflammatory properties similar to low-dose ibuprofen. Use it daily. Cook with it. Drizzle it over vegetables. This is not a small adjustment. It is a meaningful one. The fourth step is for your joints and immune system, and this is the one most seniors have never been told. The gut microbiome, the community of bacteria living in your digestive system, is one of the primary regulators of immune system behavior. When the gut microbiome is disrupted by years of processed food, antibiotic use, and sugar intake, the immune system loses its ability to distinguish self from invader. That is the biological foundation of autoimmune disease. Rebuilding the gut microbiome through daily fermented foods is one of the most powerful things you can do for inflammatory joint health. Plain Greek yogurt with live cultures, raw sauerkraut, kimchi, kefir. These are not health fads. These are ancient foods that your ancestors ate because they kept the gut ecosystem balanced. Start with 2 tablespoons of raw sauerkraut with one meal every day for 30 days. Track whether your joint stiffness improves. In my 35 years of practice, I have seen patients reduce their morning stiffness significantly within 6 weeks of consistent probiotic food intake. The 5th step is one that addresses all 3 diseases simultaneously, and it costs nothing. Every morning within 30 minutes of waking, before you eat, take a 20 to 30-minute walk, not a stroll, a purposeful arm-swinging, moderate-pace walk. Here is why this matters so profoundly for someone your age. Walking with arm swings specifically activates the dopamine reward circuits in the brain. It reduces vascular inflammation by improving endothelial function, which is the technical term for keeping the inner lining of your blood vessels healthy and flexible. And it stimulates the production of synovial fluid in your joints, the natural lubricant that reduces friction and inflammatory irritation in the joint lining. One walk, 3 diseases addressed simultaneously, no prescription required. The 6th step is about omega-3 fatty acids, and not in the form of a cheap fish oil capsule from a discount store. I want you eating wild-caught fatty fish at least 3 times per week, sardines, wild salmon, mackerel, herring. The omega-3 DHA in these fish specifically concentrates in the brain, particularly in the myelin sheaths that protect nerve fibers. For someone over 60 concerned about neurological health, getting adequate DHA from food is not optional, it is foundational. If you genuinely cannot eat fish 3 times per week, a high-quality triglyceride-form fish oil supplement taken with the largest meal of the day is an acceptable substitute. But food first, always food first. The 7th step is about sleep, and I need you to understand why this matters in a way most doctors have never explained to you. During deep sleep, your brain activates what scientists have recently named the glymphatic system, a biological waste clearance system that flushes toxic proteins from between brain cells. One of the proteins cleared by the glymphatic system is called alpha-synuclein, the very protein that accumulates in clumps in the brains of people with Parkinson's disease. When you sleep poorly or insufficiently, the glymphatic system cannot complete its cleanup work. The toxic protein burden builds. The neurological risk increases. 7 to 8 hours of uninterrupted sleep is not a luxury for a person your age. It is a medical necessity. If you are waking up multiple times per night or struggling to stay asleep, that is a conversation to have with your doctor tomorrow. Now, let me tell you what they are never going to teach in a standard medical appointment. Here is what I have learned in 35 years that they do not put in the standard clinical guidelines. Big pharmaceutical companies make the vast majority of their revenue on chronic disease management. They profit most when patients are on a medication for life. So the financial incentive in mainstream medicine is not to prevent these 3 diseases. It is to manage them after they arrive. I am not saying every doctor is corrupt. Most of my colleagues are decent, hardworking people trying to help within a system that does not reward prevention. But the system itself, the incentive structure, points away from what I am telling you today. Nobody gets paid when you eat sauerkraut and take a morning walk. Nobody profits when your glymphatic system clears alpha-synuclein from your brain because you got 8 hours of sleep. Nobody sends you a bill when sulforaphane from your broccoli activates your own internal antioxidant defense system. That is why these conversations happen here in spaces like this, rather than in a 15-minute appointment where a physician has 3 minutes to address your hands and 11 minutes of paperwork to file afterward. I have seen this pattern play out thousands of times. A 68-year-old patient comes in. Their hands show early signs, a subtle resting tremor, morning joint stiffness, pale nail beds. The conventional response is to wait and watch, to monitor, to come back in 6 months and then 12 months. And I understand the clinical caution behind that approach. But what is lost in the waiting is irreplaceable time. Neurons lost to Parkinson's do not regenerate. Arterial plaque that calcifies does not dissolve easily. Joint cartilage destroyed by unchecked inflammation does not grow back. The window for meaningful intervention is now, not next year. There are also things about the hand-heart connection that I want every person over 60 to know. Your dominant hand grip strength is a clinically validated predictor of cardiovascular outcomes. A landmark study published in The Lancet tracked nearly 140,000 adults across 17 countries and found that grip strength was a stronger predictor of cardiovascular death than systolic blood pressure. Think about that. The strength of your handshake predicted survival better than your blood pressure reading did, which means that building and maintaining hand and forearm strength is not just about opening jars. It is about keeping your heart alive. You can test your own grip right now. Find a tennis ball or a rolled up dish towel, squeeze it as hard as you can and hold for 5 seconds. Then release. Do this 15 times per hand every other day. Grip training exercises have been shown in research to reduce resting blood pressure by measurable amounts through a mechanism involving the endothelial lining of your blood vessels. Your hands can literally train your heart to perform better. Most doctors will never tell you this because there is no billing code for squeezing a tennis ball. Now, I want to walk you through 3 very different futures, and I want you to imagine each one clearly. In the first scenario, you close this video and do nothing. You convince yourself you are probably fine. You decide your hands are just showing their age and that tremors and stiffness happen to everyone eventually. 6 months from now, the resting tremor has become slightly more noticeable. The morning stiffness now lasts past noon on some days. The nail beds have continued their gradual change in color. 12 months from now, you are sitting in a specialist's office receiving a diagnosis that could have been caught much earlier. The intervention options are narrower now. The disease has had more time to establish itself. The conversation with your doctor is longer and harder than it needed to be. In the second scenario, you take some of what I shared today and apply it halfway. You start the morning walk, but skip it when the weather is bad. You eat broccoli twice a week instead of daily. You mention the tremor to your doctor at your next scheduled appointment, but forget to bring the notes you made about duration and frequency. Progress happens slowly. Some improvement occurs, but the full protective benefit of the protocol is diluted by inconsistency. You feel somewhat better, but you are always wondering if you could be doing more. In the third scenario, you do what I have described. You start the morning walk tomorrow. You build the daily fermented food habit this week. You look at your hands every morning and you keep a simple log. You schedule the lipid panel. You add the wild salmon and the cruciferous vegetables. You protect your sleep like the medical necessity it is. You build the grip strength routine into your week. And 6 months from now, you sit across from your doctor with a body that has been actively defended. The inflammation markers are lower, the circulation has improved, the neurological risk has been reduced through consistent daily habits. Your hands still show your age, but they no longer show 3 hidden diseases gaining ground unchecked. That third future is available to you right now, starting tomorrow morning. Here is what I genuinely believe after 35 years in this profession. The human body is not designed to fail silently. It is designed to communicate. Every tremor, every nail change, every stiff joint in the morning is the body asking for something it is not getting. The problem is that nobody taught you the language. Well, I have spent my entire career learning to read it, and today I translated it for you. You are not too old to change the trajectory of these conditions. You are not too far along to make a difference. In my practice, I have seen patients in their late 70s make changes that completely altered their inflammatory profile within 90 days. The body responds at any age because the underlying biology never stops responding to the inputs you give it. What you eat, how you move, how you sleep, how much you stress. These are not lifestyle choices in some abstract motivational sense. They are biochemical commands, and your body executes them whether you are paying attention or not. I want you to take your hands out right now and look at them one more time. Look at the 10 fingers and 2 palms that have carried you through your entire life. They have shaken hands, held children, built things, written things, cooked meals, offered comfort. They deserve your attention. They deserve you to understand what they are trying to tell you. And they deserve a doctor who actually takes the time to explain it. Before you go, I want to ask you one question, and I genuinely want your answer in the comments below. Which of the 3 hand signs I described today surprised you the most? The neurological, the cardiovascular, or the joint signs? Tell me in the comments, because your answer helps me understand what you need more of. And I read every single one. If this conversation gave you something useful today, hit that subscribe button right now, because every single week I come back to this channel and I translate the kind of medical information that deserves to be in your hands. Next time, we are going to talk about a completely overlooked connection between your sleep patterns after 65 and a specific hormone cascade that determines how fast your brain ages. You do not want to miss that one.